Medical Dilemma.
Welcome back to Medical Dilemma. Before we start our panel discussion, I would like to thank our major sponsor, St. Clair's Medical Center, located at Dian Street, Palanan, Makati City. Affordable, quality healthcare. And also LifeQuest Training and Consultancy Corporation and its partner Manila Workshops. Check out their websites at lifequestphilippines.com or manilaworkshops.com for their upcoming webinars, seminars, and workshops. Now, joining me for the second and third segments are my co-hosts. First, we have Dr. Teresita Sanchez, a medical legal consultant. Hi, Dr. Sanchez.
Hello, nice to be here again.
And we have Father Jerry Manlangit, Professor of Bioethics from the Order of Preachers. Hello, Father Jerry.
Hi, Zanny. Thank you for having me here.
Thank you, too. Okay. And, of course, we have Attorney Sarah Jane Sugitan, founding partner of the Sugitan Law Office. How are you, Attorney Sugitan?
I'm great, Sunny. Thank you, and welcome to everyone watching our 5th episode.
Okay, so welcome back, everybody, especially Dr. Ben Salido. Now, the first question I'd like to tackle is that of patient confidentiality in the case of HIV and AIDS. Okay, how extensive is this confidentiality obligation or issue? Let's take it from the perspective of law first.
Yes, Sunny, under Republic Act 8504, the medical workers, practitioners who are treating or who have diagnosed an HIV positive or a person afflicted with AIDS is under strict confidentiality, meaning they cannot disclose that situation to a third party, and the only persons authorized to disclose that situation is the person himself or herself, the parent or guardian of the minor, kung minor yung na-diagnose na may HIV or AIDS, and or guardian, so kung mentally incapacitated yung HIV-afflicted person. And also, in a legal proceeding, when it is required to be disclosed, then those are the only times and those are the only people who are authorized to know of that condition. Now, ang siguro corollary question to that is how about employers, for example?
Yes, yes.
And we, especially in the Philippines, we have a lot of seamen traveling abroad. We have a lot of OFWs who are constantly abroad as well, who are exposed to this risk, no? So do they have a duty to disclose to their employers? Under the law, there is no such duty. And in fact, compulsory testing, meaning mandatory testing, kung may AIDS yung tao or may HIV, is prohibited under the law.
I see. So there are actually no exceptions to this confidentiality rule or obligation?
As I said, no, those who are entitled to know the information are, of course, the patient and his parents, his or her parents, and guardian kung minor. But under the law, there is an obligation for the person to disclose that situation to his or her sexual partner.
Sexual partner.
Yeah, but there is no imprisonment, there is no criminal liability attached if there is failure. So I think that's when ethics will come in. Kasi sabihin mo, of course, if you're really attracted to this person and that person will get turned off, of course, if you tell that partner that you are HIV positive or you have AIDS. So the number one problem ng patients discrimination, diba? So in that case, although the law says that of course you should inform your partner about that situation, there is no such thing as a criminal liability that attaches if you decide not to disclose.
And this starts with screening itself. No? When you decide or you want to get the blood test, that I want to know my status, am I HIV positive or not, confidentiality starts at that point. So you can actually even use an alias, no? If you want. And but you know the HIV screening that we do before you get the blood test, no, there's always pre-test counseling, so that you know you already know what to expect if you're positive, if you're negative, things like that. But the confidentiality rules start there.
Unless maybe if there is a waiver. That's what happened to the Sarah, remember, that person who was with former Senator Flavier, and she was used as a sample to encourage other people to reveal their status. But it seemed it boomeranged. I mean, after that, people didn't want to reveal their status anymore.
Unfortunately, there's a stigma still.
Yes, there's still a
but
stigma.
slowly, as HIV treatment becomes more available to everyone, the stigma is really going away.
Father Jerry, from the bioethicist point of view, how does this confidentiality
You're
issue
right.
play out?
Confidentiality must always be protected at all times. Except, of course, in some other circumstances in which it is necessary that one has to report or someone has to disclose. But even if he does that or she does that, there are, of course, cautions that the name should never be disclosed to anybody in public, and the other circumstances, because HIV or AIDS is a social disease. There is always something associated with shame and discrimination, and we don't want the patient to be subjected in that kind of condition. We don't want somebody who is already sick and still being isolated and discriminated, and it looks like that we have not protected his dignity. So basically, a person must be protected as far as his dignity is concerned, and as far as his free will is concerned.
Now, what comes to my mind right now is, let's say I detect positive for HIV. Don't I have an obligation to tell, identifiable persons of risk, like my family, or of course my sexual partners, as you said, by law?
Yes, there is. There is an ethical obligation on your part. May not be legal, but ethical obligation on your part, because you are actually enter into some risky situation in which even your loved ones will also be at risk. If you love your loved ones, then you do not subject him into that particular situation, just like anyone else who is responsible in the society. A policeman will always give you some caution. Don't enter there, you might fall there. There is danger there. Or anyone else on the street, don't walk over there, you're going to fall. So that's a simple ethical duty on a person who is responsible. In this case, a patient himself. If he is responsible enough, then he should have that ethical duty to tell that in fact he will be or she will be at risk if I engage myself in such sexual behavior.
Although in our HIV/AIDS
Dr.
law, it explicitly says there that the HIV-infected patient is obliged to tell his sexual partner. And of course, that also applies to his previous sexual partner.
Sexual partner.
Because
Right.
But the responsibility is left to that patient,
yes,
right?
that's the
So
only
if he
thing.
does,
That's
if
the
he
only
doesn't
thing.
tell,
Right.
what
Yeah.
happens now?
Yeah, so that one is not tackled in the law.
Yeah,
But-
they're
and
quiet
that goes
about
to the ethics of the matter. Yeah.
Right.
That
Are doctors obliged to encourage or counsel patients to actually do this, to disclose it to their loved ones?
yes, because it's a public health issue, and we know that it's a communicable disease, and it can be transmitted to other people. So that's one of the things that we counsel. So compared to other patients, wherein we sometimes just talk to them for 15 minutes, 10 minutes, for HIV/AIDS patients, we take more than that because we tackle a lot of things. It's not a simple matter.
I
But
see.
let
Yes,
me
Dr.
clarify about the communicability of that
Yes.
disease. In other words, how can it be communicated or transferred to another?
Yes.
How can you infect another person?
So you can infect another person if you're HIV infected through sexual contact, unprotected, through needle sharing or body fluid sharing, usually needles. If someone is an IV drug user, for example, blood transfusion in the past, but these days we screen blood now for HIV.
But some nakakalusot ata yun
Yeah,
pa eh, sometimes.
especially in developing countries, no? But maybe in some parts of the country, but in most hospitals these days, blood is screened for HIV now. And the last is from mother to child.
Doc, you said transmission of exchange of bodily fluids. How about kissing?
So
When you
except
Yeah,
for kissing,
saliva.
no.
Except
it should
for
be
saliva.
intimate. It should be sexual in
French
nature.
kissing.
No, not even. Not even. Yeah.
Kasi nga, as you said, Father, it's a social disease. So when, I think ako then, if I find that someone, you're riding within the bus or the train has HIV or AIDS, automatically you distance yourself. You think that if he speaks or he coughs or she coughs, you will be also infected with the disease. So it's not, it's a common misconception. So it's good that we need to inform the public that it's only through sexual contact, a blood transfusion or prenatal, if the mother is an HIV positive
Yeah.
carrier, you can pass it on to the baby.
In the past, there was even misconception where when you use the toilet,
Toilet.
and
Same.
of that was used by an HIV patient, you would get it, but no, you don't. No? Just those things that we did talk about.
Going back to mandatory testing, why can we not implement that?
The policy of the law seems to be to uphold the dignity of the person, as Father said, to respect the privacy of the person, and at the same time to encourage the patient to seek treatment. Kasi the tendency, the human nature dictates that we'd rather keep that to ourselves, or we'll keep it secret. Kasi nga, then I think if not 90% of the cause is through sexual contact. So it means that you are promiscuous and therefore etc. So there's a balloon of negative social stigma that is attached to it. Although of course when you trace it, that isn't the case all the time, no. But still, as you said, we do not. The law does not mandate compulsory testing for HIV positive patients as a condition of employment.
Only as a condition of
Oo.
employment.
So you can test for anything else, like as you said, no, if you find out you're HIV positive, you require all your family members to test for it. That's allowed under the law. However, if you are an employer, then you will discriminate against HIV positive persons or AIDS unless you have grounds to do so. For example, the nature of the work requires,
Like
kasi
in
may sex
hospital, you're a
workers
surgeon,
Yeah,
right?
abroad there are registered sex workers. So if the nature of your job is sexual contact and you will contaminate your customer, then you are obliged to undergo mandatory testing. But that's not the case under the law. We don't have such a thing as registered sex workers. So
Can you not
I
argue
ask-
that, testing is for the protection of the majority's interests?
In the first place, it's first the protection of the person,
Yeah.
the patient himself, before the others.
Yeah, the basic bioethical principle in not requiring or making it mandatory is autonomy. So you maintain the patient's autonomy. So that's basically the main principle behind that.
There are certain drugs that can be used, no, for this treatment of this disease, no. But it's unlike TB, where after a certain point in time, like 2 months taking regularly the drug, you don't get infected anymore. What about with this drug?
Yeah, so basically,
antiviral.
usually when we give medications for HIV patients, these are minimum of 3 drugs. And these drugs are very effective. Once your viral load or the virus, how much virus you have in the blood is very low, then you can hardly infect other people. Very, very low risk.
Even
to
with
infect.
sexual intercourse?
Even with
It's
sexual
not always,
intercourse?
It doesn't follow that just because you had 1 or 2 that you
Yeah.
will get infected. Is
No,
that
yes,
correct?
that's true. Even when you have sex with an HIV infected patient, there's a less than 1% chance that you can.
As long as it's medicated, yeah, it's the
Well,
proper medication.
even if the patient is not on medication, but when you're on medication, when you're the patient, you're on medication, the risk even becomes lower.
It's good.
Wouldn't that give a false sense of security to society?
Well, for one, we really encourage our patients to take the medications every day. And there are debates about it, but a large percentage of doctors, maybe it's a little bit divided, but really, when you are suppressed, when your virus is suppressed, it's very, very, very low chance that you can transmit it to anyone else.
And you
that's-
can
that's
continue
a-
practicing your regular lifestyle.
Yes, yes. There are even guidelines for healthcare workers, surgeons. There are, of course, just when your virus levels are very low, then you can continue to practice.
Okay.
For example, put your hands inside the chest of a patient. But during your follow-up with your HIV doctor, if your virus is above a certain level, like more than 500, for example,
All right. I'm
You
sorry
can,
to interrupt the discussion, but it's time for another commercial break. Don't touch the dial. We'll be right back. Thank you so much.
products were designed to be used in industrial and medical economy.
So if I were you, I would be a lot more careful about what comes out of my mouth, especially in such a place where anything can spread like wildfire.
Imagine it when you share something to a public, you find that experience, and that experience so rich it could change other people. Okay?
Like, there are other settings, right? So you hear it, you see it, and then you can smell the fireworks.
Now, would it be okay by asking you're already practicing
Indeed, the word here will mean to be
something that I've learned
words can inspire and words can destroy. Choose yours. Okay?